Endometriosis is not a medical condition we hear about every day, but it is a disease doctors believe impact 1 in 10 women. In the most simple terms, endometriosis is an inflammatory disease. It impacts everything from conception to daily life. I sat down with Dr. Elsa Deeren from Intermed and Angie Bell from Angela Bell Acupuncture to learn more about how the chronic disease can be diagnosed and treated and how painful symptoms can be.
I see patients in the clinic who are taking Advil really regularly throughout the day for anywhere between like a 2 and a 7 day period of time. And it sometimes prevents them from working. They're bed bound for the day or several days in a row.
Right.
They're in pretty significant pain.
From the onset of symptoms to when a person gets the diagnosis of endometriosis, on average it takes about 6 to 12 years, and seeing multiple providers.
6 to 12 years, that's a long time. And you have to have surgery, right, to actually be diagnosed with endometriosis?
It's true that surgery is the only way to officially confirm endometriosis. They'll do a laparoscopic surgery to look inside the abdominal cavity to see if there are any endometrial lesions. But there are a lot of things that you can talk about that would lead someone to believe that there's a very strong likelihood that there's endometriosis. So treatments can begin before actual surgery if you have the right provider, someone who can recognize the signs. So we're talking about definitely pelvic pain and menstrual cramps, but also oftentimes fatigue, chronic acne, bowel disruption, and it can be pain throughout any time of the cycle. So it's hard to diagnose because you technically have to have surgery to get a real diagnosis, but you can have a pretty strong suspicion that there's endometriosis just by looking at other symptoms.
Yeah, and you mentioned treatment. What options are there out there for treatment?
In my world, the first thing that we're talking to patients about is anti-inflammatory medications like Advil, and hoping that we direct them to use them safely. And then using oral contraceptive pills in a continuous fashion to suppress that hormonal fluctuation that someone sees when they're naturally cycling. We also use progesterone-only methods like intrauterine devices, arm implants. There's some alternative pills to oral contraceptive pills that also have a hormonal effect. And then surgery is needed for those who might not have a response to those treatments. And that can be to address actual physical cysts or fertility issues.
Endometriosis at its core is an inflammatory disease. And so when we're looking at natural treatments, we want to think about things that are going to reduce systemic inflammation. So I'm an acupuncturist. Acupuncture has been really wonderful. When you're looking at acupuncture, you're looking at helping the body function optimally to reduce inflammation and improve immunity. We don't fully know 100% what the cause of endometriosis is. But one of the things that they're looking at now is that really it's an immune dysfunction, that these lesions are growing where they're not supposed to grow, and in some people the body is able to take care of those lesions, and in some people they're not. But certainly above and beyond acupuncture, people can start doing things at home just with diet. So I tell patients all the time, what we really want to focus on is boosting nutrient-dense food consumption, such as vegetables and fruits, healthy meats, healthy fats, and reducing inflammatory foods. So at a base level, that's things like alcohol, caffeine, sugar, processed foods.
Is it still possible to live a happy and healthy life despite having endometriosis?
Absolutely. Yeah, I think it is about making sure that you really consider what you're going through each month. If you are someone who is experiencing pain with your cycles or even off cycle, to not normalize it. I think that's the biggest thing. We hope people walk away from this segment knowing that it's not normal to miss school or to miss work because of painful periods. It's not normal to suffer through intimacy with a partner. It's not normal to have painful bowel movements when you're on your period. So coming to talk with your healthcare team, they're going to want to hear your story.
And I will say, be your own self-advocate, because it's still a disease that isn't necessarily easy to identify. And so you might go to a first doctor, and that doctor or provider of any kind could be dismissive and just saying that it's normal. But if you know within yourself that this isn't normal and that this is really impacting your quality of life, you have to continue to kind of self-advocate and find a provider that's really going to take you seriously. The other thing I'll say just about, like, can we live healthy, happy lives with this disease is, you have to find treatments that are appropriate for where you are in your life. So a treatment for somebody who's a teenager in their early 20s and nowhere near baby making time might be different than someone who's in their mid to late 30s or early 40s and just starting their fertility journey. So it's important that you really talk about those sorts of things with your providers so that you can use the most appropriate treatment for where you are in your life right now.
To learn more about endometriosis, just head to our website or app. And by the way, we are hoping to share personal stories of those impacted by the disease. If you or someone you know has been diagnosed, have them reach out to me by email or through social media. We'll be right back with more 207.